Welcome, everyone, to the Lion-Hearted Podcast, where courage meets purpose, and every conversation is an opportunity to inspire and ignite the lion heart within us. I'm Dr. Steve Rasner, and we've been doing these podcasts now for 4 years. For quite a while, I've teased you with the concept of me interviewing not just well-known clinicians, but specifically those clinicians that had the most influence on my career and hence contributed to the creation of the lion-hearted dental community. Today, we have the incredible Dr. Mike Pikos joining us, and there could be no greater influence, not just on my career, but the career of thousands of dentists around the world. Dr. Pikos graduated from the Ohio State University and went on to do his oral maxillofacial training at the University of Pittsburgh. He is the recipient of numerous educator awards, including the Saul Schluger Award as the top educator in 2015. He's an adjunct or associate professor at Ohio State, Nova University, the University of Florida, the Grace School of Dentistry, and University of Alabama Perio Department. He's on the editorial board of 5 journals: Implant Dentistry, Inside Dentistry, the great Journal of Aesthetic and Restorative Dentistry, which we're all giant fans of. He is on the editorial board. He is the author of a great book. By the way, it's a book that stays on my desk, The Bone Augmentation and Implant Dentistry. And of course, Dr. Picos is the founder and CEO of the Picos Institute that he started in 1990, and he's been teaching advanced bone and soft tissue grafting courses, along with full arch immediate reconstruction, with alumni now number more than 6,000 from all 50 states and 67 countries. Welcome, Dr. Mike Pikos.
Thank you, Stephen, for that introduction. I'm just flattered and honored to be part of this podcast with you.
Well, you know what I notice? I've known Dr. Pikos for 20 or 25 years. Sadly, I'm probably one of the top 2 that have taken the most courses from him ever, because it's just too much for me to get at one time. And I just go back and back because it's just like a fire hydrant of information, and I can't get enough. And as you'll see in this interview, listen, he's my friend, and I'm proud to call him my friend. But I've never steered you wrong. I don't send you to every educator out there on the market. I think my recommendations over the years have been right on, whether it's Spear or Dr. Mish when he was around, and Dr. Pikos is the gold standard in my opinion, and a lot of the opinions of many other fine clinicians. And so I've taken a lot of him. And what I noticed, I've had the opportunity, Mike, to actually be in the classroom with you on 2 different occasions. So we were in a course together amongst many other dentists. And the thing that's amazing about you, which makes you you, is that if you watched him in the course that he takes copious notes like he's a first-year dental student, even though I'm sure he could present the material better than the guy presenting it. And that's you. That's who you are to me. So before we dive deep into our conversation, share a little for a second or two about your journey. I mean, you graduate from maxillofacial surgery, and, I'm sure you didn't get out that first month and say, hey, I'm going to start an institute. So how do you go from practicing to saying and thinking, hey, I want to teach this? How did it start?
Well, that's a great question, Steve. I can tell you that it's been quite a journey, and I would be absolutely untruthful with you if I told you that I planned it and just orchestrated the entire concept of an institute from the get-go. Not at all. In fact, the way it really started was with about 8, 10 of my buddies from all over the country giving me a call saying, "Hey, Mike, we see you're quite involved with this implant stuff, and you know, kind of caught wind of a few things you're doing, some cases we talked about this and that. Uh, how about putting together something where we can come down together, a bunch of us, and spend a couple 3 days with you and just share your knowledge with us?" And I thought, wow, that's why not? Like, are you kidding? So that was in the day of the carousels, if you recall. So I always had two projectors and two carousels going at the same time. I just like the idea of two, not just one. So long story short, for 2.5 days, really, we just powwowed like a big, poker game kind of thing. And in the upstairs room of my then Palm Harbor office, the way it was set up, we crowded the group in there, and really it was a fun time. And I thought, this is kind of neat to do this. I always enjoyed education and learning, but really what propelled me to get more formal with an actual course, of course, content and formal education, etc., was taking some courses on the road, which I did right from the beginning in 1983 when I started my practice. Implant dentistry, implant surgery intrigued me, and at that time it was really all about two people, as you well know. That would be Jerry Nisnik and Dr. Brandemark. So you would be in one of the two camps if you were getting involved with implants. So for me, it was Jerry. And through the 80s, I placed about 1,000 implants from 83 to 90, and just got the biggest kick out of that whole thing. It was just a real turn on for me, and I'm sure many other clinicians at that point in time. But quite honestly, we succeeded in spite of what we did, and had some fun along the way. But it was really about 88 to 90 where I got real interested in the teaching element, because, as I said, I had taken some courses on the road, ongoing, and that just continued. And boy, I tell you what, when I spent some time with a few clinicians that were already doing some teaching and some folks that really influenced my career significantly, I can just tell you that the light bulb went on, and I thought, wow, this is really neat. And when my buddies had called to get together with me, and those days I mentioned that I shared with them, that really just turned me on. I thought, this is something that could be very exciting to continue to do. So really it was in 1990, fall of that year, that I had my first course, and it was a bone grafting course. And when I look back upon that course, quite honestly, compared to today, it'd be like a Model T Ford compared to a brand new, turbocharged Porsche. The difference in terms of content, for sure. I'd be embarrassed to even tell you what I was teaching back then, but that was state of the art, to be honest. So fast forward to today, and this thing has morphed into something that honestly has been exceeded my expectations and my wildest dreams of ever having anything of this magnitude, and having so much fun along the way, to have all these different courses and have my own building designated for as the Institute proper, etc. Because prior to that, I was more of an itinerant. Started out in my Palm Harbor office, as I mentioned, the upstairs, where we crowd 20, 24 folks in that small room, the two projectors going on in the back of the room, and a whopping two exhibitors, one being at that time Calcitech, and the other being Bob Selvin. Bless his soul.
Yeah.
He was the sole exhibitor other than the implant company. And, there's Bob with his little suitcase, like a little carpetbagger, open things up, and there's his wares. And that was it. So that, then again, fast forward to the present, and like, my goodness, what's happened? I blinked my eyes, and it's amazing what has transpired. And as you mentioned, I've got now more than 6,500 alumni, all 50 states, 67 countries. It's been fun. I've enjoyed the journey. I love to learn. As you mentioned, I average about 120 hours of CE myself every year for all my 40 years, well over 6,000 hours and counting.
So when you go out, and I've never really asked you these details, but it's true, right? You've taken like COIS courses and you take prosthetic courses and everything, right?
Absolutely. In fact, probably I'd say a good 40% of all my courses over my career are non-surgical in nature, i.e. restorative based, occlusion, you name it, biomaterials. Yes, I mean biomechanics. Again, I just love to learn. I have a passion for it, and quite honestly, that's what continues to drive me. Even here, 40 years in practice and 34 years of the institute. It's just an ongoing thing. I feel like I'm a young kid still. And as you mentioned, I kind of had to chuckle when you were talking about me taking copious notes, because that's just the nature of my beast. I like to be front row, and
Yes, you do.
got my tape recorder on. I like to audio tape and play back things as I need to, down the road, etc. But I'm just a consummate CE junkie,
You are.
and I love to learn,
So,
as you too are. I know that.
so I really have taken an enormous amount of CE at the Picos Institute, and I'm telling you guys this on purpose. It's not because I'm just friends and I have respect. I want you to picture what it's like, because I know many of you. One of the cornerstones of being a lion-hearted dentist is a lifetime commitment to education. You've heard me say that numerous times, and so, and look, I've been to courses as recently as 3 years ago in Florida, where you walk in and and I don't know, maybe this is inappropriate, but I've got to say it. And, it's a dimly lit room, and there's like some crackers and water and stuff. And I paid top dollar. And it's embarrassing almost to me, because I give courses as well, as a lot of you know. When you go to Mike's, to the Picos Institute, and you can hold me accountable, it's an event. And steak and potatoes an event. It's not covered up with BS, with fluff and nothing. I'm talking about unbelievably organized, a beautiful venue. I mean, the amount of thinking, which I'm going to ask you about, even the chairs you sit in, because his courses are 3 days or more. And, the chairs are out of this world. Everybody notices it. The venue is immaculate. The vendors are in a different room that's immaculate. The food is killer. The labs are at a different level than I've ever participated in. Because listen, you can't, if you're in this science of learning, implant and surgical dentistry, you can't just have didactic instruction. You got to have labs hands-on. So my question for you, Mike, which I've never asked you. So when you go in there, in the back of the room, there's a row or two of high-level oral surgeons, periodontists, prosthodontists, guys that could probably give lectures themselves and probably do, that you're just hubnubbing with at a break, which I do on purpose. And you just go back and ask them, hey, it may have nothing to do even sometimes with the subject matter that Mike's talking about. But I want to know, how did that come to be? Like the level of labs or all the stuff I just mentioned. Do you have board meetings? I mean, I never asked you this.
Well, Steve, things evolve with time, and it's still a work in progress, to be honest. I'm always striving to make things better. So the evaluations that we give out for all of our attendees, I literally read every one of them. In fact, my entire team reads them, but I in particular zero in on the comments and want to know, firsthand, what can I do, what can we do as a team to make things better for our course attendees? Because the goal one of the main goals, really, as I see it, for education is to make sure that the environment is conducive to learning. So as you mentioned, the creature comforts and things like that, the informality of being able to get up and grab a snack and do whatever, go to the restroom. We have audio piped into the restroom, so you're not going to miss anything.
Yeah, right.
You don't want.
Do you hear what he
you don't have
said?
to race.
When you go to the bathroom, you still hear the lecture in the bathroom. I mean,
Yeah.
who thought of that? It's pretty good. I like it.
Yeah, well, I got that idea honestly from John Coyce. I was a scientific advisor for him with implants for a number of years, and can't say enough about what he's done, certainly on the restorative end. So got a lot of good ideas from John, but that was one of them in particular that I thought would be very neat to do. So again, creature comforts, making things, just the environment as conducive as possible to learning. So that happened over time, certainly. And I think most importantly is the fact that I want to really focus on making things as good as possible, so that in terms of what we offer there, in terms of faculty, they're handpicked, yes, for all of our courses. The workshops, they've evolved into something that is certainly practical and consistent with our theme of, when all is said and done, depending on the skill sets that one has coming into our courses, Monday morning, they should be able to incorporate X number of material, X amount of that material immediately into their practice. Because our whole theme is really about being clinically relevant. Evidence-based, absolutely, but clinically relevant. In other words, the last thing I'd want to do is bore everybody with statistics and metrics and histologies and you name it. I could do that, but it would be ridiculous, of course. So short of that, I offer and have always, from day one, adequate evidence base for everything we do, but yet making real sure that everything I share is clinically relevant. And the reason is, it's because what I do every day in my career, in my practice for all these years. And by the way, I'm still clinically relevant myself. Still cranking things out at a pace of 4 days a week. So I enjoy that. I have passion for the clinical element, but I have great passion for the teaching element as well.
Which reminds me of one aspect I didn't bring up that is very relevant here. So in Mike's major room where he's providing the information, I don't know if it's not movie theater style, is it? Or is it where it rises up?
No. We're at a level plane,
okay.
but we have modular units that
Right.
we can move around. Yes.
Well, the reason I bring that up is, if he's doing a sinus lift course, often on the third day, there's this, to the right of the room is this giant glass window where he's doing the surgery. Okay. Now, obviously, you all can't see the details of what he's doing, but right in front of you is a movie-sized screen. You're in the mouth. You're on his lap. I mean, I don't know how he does it, or where you got how you ever worked out the details to where that's evolved. But there could be no better. You know what? Just look at the videos that you see online that you guys send out, and you'll get a picture of exactly what I'm talking about. Because it helps. You have to have that vantage point surgically to be able to take it from the didactic portions of his lecture into your office on Monday. And I'll tell you, I took your sinus lift course, and I could easily and confidently teach sinus lifts, and I do, to anybody from every protocol that you used. I don't want to jinx myself. I was going to say, I don't know if I've ever had one fail, but I've done a lot, and they all came from the principles you used. So that brings me in to what I wanted to say next. You've taught the sinus lift course. You've got the alveolar ridge strategy course. That's amazing. By the way, I take that course about every 2 years, just because the half-life of a lot of this information, everybody knows, this changes. And so something that was in vogue 5 years ago, 4 years ago, changes. And I just take it, as a lot of guys do, as a refresher course. I just took the zygomatic pterygoid implant course. And I want to say this, I'm not even doing those procedures, but it helped me so much in my full arch treatment planning, because it was mysterious to me. And hence his title is Demystifying Zygomatic and Pterygoid Implants. And he does demystify them. And I'll tell you, you want to talk about a lab, the best lab I've ever been to in my 44 years of taking courses was that lab, the cadaver lab that you had off base at a different place. You talk about organized amazing. It brought it all together. And I don't know if you've ever done, you probably have. You had an idea and you executed it and it didn't work, so you switched to something else, but it's amazing. But what I wanted to ask you is, okay, so finally, and I've been screaming for years, as well as other courses I want them to give, is the foundation course. So lots of you guys have taken my extraction course. And where do you go from there? You have abundant opportunities, and many of these maxi programs and other programs, they're excellent. And I haven't obviously taken Mike's core foundation, but that's really what I want to hear about. Even though I've been doing implants for 27 years, I kind of want to take it. I want to see what he says, because foundation is everything, right? So tell us about it, Mike. How did it come to be?
Thank you for your comments. Steve, really had wanted to do this for a number of years, but we get busy, and it's all about focus, certainly, and my advanced level courses have been keeping me very busy over the years. As you mentioned, the soft tissue grafting course, and the bone course, which is the signature course for me. It's a 4-day, very intensive, from A to Z, single tooth and full arch reconstruction and everything in between, et cetera, et cetera. Our full arch courses, on and on. But really, I had colleagues over the years, course attendees, just say, "Hey, Mike, I've got a young associate, and he or she is just wanting to get excited and learn about basic implants and what have you, basic implantology, but not sure what to do, where to go, etc." And I've always thought, well, yeah, there are different courses out there, different curricula, and they do a good job, those folks that are involved, no question. But I really wanted to do something very different and special, meaning having connectivity to the learning process, meaning not just one session after another without them being connected, so to speak. So what really drove me was just wanting to be able to share the information that I have learned over the years, but backtracking to a foundational level. So as you mentioned, the word foundation, sure. In fact, the descriptor of this particular core curriculum is, in fact, Foundational Implant Dentistry Demystified, the core curriculum. It's essentially a continuum. So it's focusing on basic principles of implantology and surgical-based protocols that really would be, in my opinion, of tremendous value to those clinicians who are not surgically based and have a concern, maybe some trepidation, some fear about, why or how can I get started? Should I even think about it? Fear is what? The unknown. We all, understand that. And when you don't understand something, well, then there's the fear factor. So what I've attempted to do myself with a very solid specialty-based multidisciplinary faculty is to demystify these different concepts and principles and protocols and simplify them in such a way that there's continuity, yes, and in fact, as I see it, there's some real huge advantages to this particular continuum because, number one, it's really based on my 40 plus years of private practice. And over these years, again, as I mentioned, having taken so many CE courses, and I continue to do so, this is, as I see it, a distillation of all of that experience and concepts and protocols that I've developed over the years into such a manner that, we will have basically, step-by-step protocols for everything that we'll share with our course attendees. So for example, Module 1, and by the way, there are 4 modules in this continuum,
Okay.
all 3-day intensive, comprehensive programs, courses, if you will. So day 1 of each of these modules is devoted to lecture discussion, as are days 2 and 3 AM, but the PMs are very intensive workshops. with pig jaws, models, and related items that will give our course attendees a very, very hands-on experience with all of the protocols that we share. So again, Module 1 will be focused on single tooth implant placement and extraction site management of sites that are not compromised, as well as the basics of.
So I want to interrupt you for a minute. So those are my listeners that have taken my courses. That's always a giant surgical question. Do I place an implant at the time of extraction? Right? How do you know? What core principles are you using to make that decision? And so that's the kind of stuff I'm sure you're going to dive deep on, right?
Absolutely. And in fact, again, just looking at the basics of incision line. Well, let me back up. Diagnostic
Okay.
treatment planning being first and foremost. That's
Yep.
will be at the heart of each of the modules. And then looking at the basics of, and by the way, that's CBCT based, of course. But then look at the basics of, for example, incision line development, how important even a millimeter or two can make in terms of creating that initial incision, whether it's extracting a tooth or placing an implant, flap development, soft tissue work, suturing, the basics of single implant placement, both digital and analog, by the way. We will be teaching both throughout the modules, certainly. So that first module focusing again on the basics of anatomy of the maxilla and mandible, certainly the basics of CBC technology, how to read CBC, how to read our scans, and again, diagnostic treatment planning, single tooth implant placement, extraction site management. That's all pretty much module 1. And then module 2, we then continue the diagnostics and treatment planning to a little different level that will include now placement of 2s and 3s implants, for example, in a given arch, along with related anatomy that will be in NCBCT interpretation accordingly, as well as biomaterials and the use of blood-borne bioactive modifiers, specifically PRF, and even recombinant proteins. So all of that is in Module 2. And then Module 3 will zero in on soft tissue grafting in particular, using autogenous tissue, i.e. free gingival grafts, along with dermis, and guided bone regeneration basics, so that our course attendees will be able to understand and appreciate, and most importantly, incorporate into their respective practices some basic GBR surgical protocols. And last but not least, our fourth module will zero in on overdenture fabrication, both from a surgical, of course, and restorative perspective, and as well as peri-implantitis, hygiene maintenance, and related topics as well. So in a nutshell, with these 4 modules, as I see it, will allow our course attendees to do, once they've completed, is feel very, very confident in what they're able to do, because there is redundancy built into each of the modules. I love to have reinforcement along the way, which is at the heart of all of our courses, as you know, so that by design, I have repetition, and not just repetition within each module, but from module to module. So this is what I think separates us, among other things, from other types of continuums that are out there and available to us, certainly, meaning that there is a method to the madness. At the core of this is, again, of what I'm all about for 40 plus years of private practice. So I've instilled that into the core curriculum, yes, and our faculty will be representative of that, but in turn, they will bring to the table their respective experiences that are very unique as well. So our attendees will have the value of oral surgeons, of periodontists, of perioprost, and straight prost. So all of our faculty, again, handpicked, super great individuals, and really all-stars in and of themselves of what they have accomplished. So advantages, again, of this core curriculum, the fact that I've got 40 years of experience incorporated into this into the program, yes. And two, the continuity element I think is so important, again, from module to module, as opposed to just there be a disjoint between them. And certainly the importance of being able to have an ROI from all of this, meaning all of this sweat, blood, and tears and sacrifice from family, from friends, you name it, the practice, and the monetary investment. The ROI will be amazingly, my goodness, the return will be so quick. A matter of 5 or 6 cases that we will teach you how to do in a very straightforward manner will allow you to reap the harvest, so to speak, and more than compensate for the monies that will have been spent on these modules. But more importantly, as I see it, it's a win-win for our patients, in particular, our course attendees, patients, absolutely, because under one roof, how nice is it to have everything done right there? And you know that, Steve, you're proof of concept for all these years, and I've admired what you have done in your career, because you've taken, unlike a lot of folks that will take a course and not implement, you immediately go back and implement and take it still to a different level. So this is what our attendees will be able to do, to under one roof be able to obviously perform the restorative element, because essentially most of our attendees will be restorative based, yes, but then add the surgical element and surgical realm of implantology. So then also keep in mind that the personal growth element to me is so huge for our attendees, because I've seen the changes in so many of my alumni over the years as they've come back and taken additional courses, etc., and just see the glow in their face of being able to share cases with me and saying, hey, look, Mike, what I've done. Look at this case. Look at that case. And most importantly, again, knowing that there's a change in their own psyche and their demeanor and the growth professionally that is important for all of us. Because let's face it, you know, Steve, that nature is you're either growing or you're dying. There is no stagnancy in nature. So for us as clinicians, I think the worst thing possible is to just stagnate when you're done with dental school, which I call boot camp, by the way, and even the GPRs. I mean, there's only so much we learn then. So as I see it, it's lifelong learning. That's really what it's all about, that we're students for life. So this core curriculum, as I see it, will serve as an amazingly foundational level of material that will provide our attendees, again, so much great information, but practical information in a very simplified manner that will demystify literally the fear that so many of us have, again, of the unknown. We'll make it so very straightforward that, first and foremost is avoiding complications, certainly preventing them right up front. So the prophylactic approach is what we're all about. And then, of course, complications will happen regardless, and we will show how to deal with those complications as well. So really, in a nutshell, it's a very comprehensive foundational course, and I can go on and on because I'm so passionate about what it truly is about and the time we've taken to put it together. But suffice it to say that our attendees will look back, I'm certain, and say, wow, that was one great effort, well worth the time and trouble. And look what I'm able to do now
Yeah.
with these new skill sets.
I'm kind of surprised, to be honest with you, and I'm happily surprised that you actually did this. Because, guys, think about it. Think how hard it is. I mean, Dr. Picos, when I go in any of his courses, I'm telling you, they are super. If there's a GP there, and there's many, they're super GPs. It's intimidating. There's periodontist, prostos, all there to learn what you came to learn there. And I got to tell you that even training like that, at the end of the day, you go back to your office, you're alone. And you need there's going to come a time in your implant career where you're going to go to do a case and you're not sure whether or not should I do this one stage, which means, should I remove the tooth, graft, and come back, or one stage is placing it the same day? And you're not going to, if you don't have a strong foundation, you're going to make mistakes.
The being able to sign up for the core curriculum, it will fill fast. We have limited seating at our institute, 36 spots, and our faculty ratio will be exceptional, 8 to 1, 8 attendees to 1 faculty person. And by the way, we are offering really a very solid special right up front, meaning if in fact there's payment in one lump sum, there's a savings of $2,000, and adding to that another $2,000 savings by having a scholarship, which really is available now for virtually all of our attendees via by Horizons or Osteogenics or Stella Life. So these are different institutions that are offering the scholarship. So really, if you look at that more critically, the cost per module is just under $5,000, which is an amazing number for the information that you'll be having for each of the modules. So we'll have we'll offer that up, Steve, as a probably QR code for the participants of the podcast. Sure.
You'll make a mistake, as Dr. Picos just said, even if you do have a strong foundation. But it's where it all begins. To me, and I've said this in every lecture I've done in the last 20 years, the shortest, listen, what we chose, dentistry, it's tough. Nobody's going to tell me it's easy. But you can have an amazing career, in my opinion, if you just train yourself, number one, and you've heard me say this 1,000 times, in oral sedation, because oral sedation allows you to attract patients that other dentists just don't have the time for, because it's not easy. By the way, I'm sitting here on a Wednesday night, and I just picked up a humongous case for one reason only. He was scared. And I've been doing this thing for the oral sedation thing. And of course, there's many patients we IV sedate, but oral sedation is a very effective way to get a patient population in. Well, guess what? You have to know how to take their teeth out, because they have teeth universally that will need to be removed. Well, if you're going to, and then you have to know how to graft. All of that I learned, my best stuff, with Dr. Picos. Well, if you're going to go that far, why wouldn't you take it to the next step and learn how to replace teeth with implant therapy? And I've said this, Mike, and I'm sure you agree. Even if you stuck to just abundant bone cases, you'd have a great career just doing that. You don't have to ever even get to sinus lifts or all the other things that go along with deficient bone to prepare that patient for implants. But I'm going to tell you what's going to happen. Obviously, it's not for everybody. But for those of you that go down this road, I'm telling you, I remember the first implant I ever did. It was on my mom, by the way. It's a different accomplishment. If it's a different fulfillment for you as a clinician. And it's a road that I know many in the lion-hearted community have chosen. And I am just ecstatic that I can now offer a place that I am so confident. I'm serious. Listening to you, it makes me want to take it again. I think I'm going to. I do. I just, there's never enough repetition on foundation principles to me. And that's what I started to say to you before. Like, given all these high-level courses, it must be kind of hard to go back to the basics. At least I think it is. Was it? To put that together?
That's a great question. The short answer is yes and no. The yes is that, I really, in fact, that's really the big reason it took me so long to really come to grips with the fact that I'd have to go back to foundational principles. Yes. And it's not that easy to do that. I agree. But the no is that once I realized that, my goodness, I should have done this sooner, because look at this now. What a great concept of really revisiting the basics. I mean, that's what it's all about for all of us. The building block starts at a foundational level, and to revisit those, I'll tell you what, it's a nice refresher for me, all the way around, and that's what I have really embraced now, and truly have wrapped my arms around it. To be quite honest, I love the fact that now I'm revisiting all of these basic things that you can't remember everything certainly, but to revisit, why not? And by the way, added value to this particular continuum is that we'll have a closed panel WhatsApp group just for the course attendees, and our attendees will have unlimited access to my audio. I'm sorry, to my video library, which is extensive as you can imagine, as well as the mentorship ongoing of all of our faculty being accessible to our attendees via that WhatsApp group, so that cases can be posted and looked at and commented on, et cetera, et cetera. So all of that to me is just exciting, because again, back to the basics. I mean, why not?
You know what? I'll tell you this now. Those of you that go on this journey, and I'm so excited for those of you that are going to, there's going to come a time when you do have a failure. Everybody has failures.
Absolutely.
And what you're going to say to yourself is, I knew better. I changed the role on something that I knew better about. Maybe it was an off day. Maybe you thought you could do something and you don't have a sound reason for it. But that is why the foundation principles are so strong, so needed for you as you embark on this particular learning curriculum. Because there's going to come that time where nobody's in that room but you. And I always say, Mike, if you're not sure, take the conservative road. Wait an extra 4 months. 4 weeks. Do an uncovery at 16 weeks versus 12, or, get another medical workup. Don't work on them if they, don't do an implant if you can smell the cigarettes on them, et cetera, et cetera. He mentioned, and I told you this earlier, there's going to be times when you're in the back of the room and you're going to ask how a prosthodontist, imagine that, like he's sitting next to you, how he goes about taking an impression, or does he always go digital, and any tricks to teach you. And that's why they're there. They want to teach you that. So I'm ecstatic, as you can see. I want to say two things, Mike, before I let you go. One is, and this is God's honest truth, I was coming back from Florida Sunday, and it was Easter Sunday, as you know. And my plane got delayed and canceled because of all the traffic. So we were on the plane, we deplaned, we got back on Monday morning, and it's unusual because you kept your seats, and the gentleman that was there Sunday was there again on Monday, and I hadn't said anything to him. And I had this shirt on, Rasner Institute, right? And he said, are you going in to teach today? And I don't always, it's a very, by the way, I stole this idea from you because you give those shirts out, and I love it. And we got to talking, and I said, so what do you do? And he said, I'm a dentist. He was one of my associates, by the way, took your course and loved it. I said, oh, okay. Are you on your way out? And we just were talking, right? And he said, well, I was on my way. I swear, Mike, this happened. Because I was on my way out. It's like 62, I was done. And now I'm doing 4 arch cases. I said, well, how'd that happen? He says, I took a Mike Picos course. I swear to God, that's exactly the conversation. He says, it reinvigorated me. It got me back in. And now my whole career has turned around. This guy's 64 years old now. So you have big influences, Mike, on a lot of our colleagues. And my final question to you is, I don't know if you can answer this or not, but looking back, what is one piece of wisdom you've gained that you wish you could tell your younger self or others who are starting this journey?
I would say probably 2 things. One being that, we're all in the same boat, and that lifelong learning is super important. There's no question. And that it's of paramount importance that we continue to take courses, all of us, to continue to learn because, again, the half-life of our technology is so short. But with that said, I think probably the most important maybe pearl or bit of advice, of maybe some wisdom of my years that I can share with all of my colleagues, and that would be to not lose sight of a proper perspective, meaning truly, I think the value for all of us should be, our spiritual base should be first, followed by our family, and then our practice. And have I always abided by that? I'll be honest and say no. I have strayed from that time to time. Yes, I have. But I've gotten back to true north, and I thank God for that, because truly, to put things in perspective, we're not here forever, and we are passing through. There's no question. So just to, again, put things in perspective, when we say yes to something, we're saying no to something else, and that something else typically is our family. And I'm as guilty as anyone over the years to have done that, sure. But as I've learned with time, and I wish I had someone to have told me this from the beginning, it would have made it easier all the way around for me, quite honestly. But to put things in perspective, we just have to prioritize accordingly. And that when we're at work, we need to focus on that 100%. But when we're home, the same goes there, to focus 100% and not have that unfortunate, the great technology we have of that phone to be, right by us, and not be paying attention to either family or friends is not a good thing, certainly. So again, not to sound like a preacher here, it's just that I think those items are of importance to me as I just, think about this as you just sprung this question on me. I think these are important points to share with everybody.
It's great advice. And you know what's funny? I mean, as you get older, some of you younger clinicians listening probably, I know it did for me. It went in one ear, went out the other, and I missed it. I'm looking you in the eye right now, those of you that watched this podcast. I did. I missed most of my kids growing up. And you can never get it back, and it hurts. I mean, it does. It hurts deep. I mean, my kids are in their 30s now, and you have to care enough to work hard enough to make it all happen. And, you got to treatment plan your personal time, vacations, or it doesn't happen. And date nights. And I know it sounds corny and stuff, but listen, being a super clinician, whether you're a specialist or a GP, does require a lot of time, abundant commitment. And you can't just go off and do that and forget everything else, or what's the whole point? At the end of the day, we're all doing what we're doing to be fulfilled. And that's part of that is your heart, not just your brain and your pocketbook, for God's sakes. So listen, I want to close with this. I know I came on here strong as a pro Picos Institute guy. This is from I wanted to do this with Dr. Picos because I'm so proud of my association with him and his institute and everything he's done for me and a lot of guys, thousands of clinicians. And, it is what you're hearing is enthusiasm from a 25-year commitment to one institution of learning, as well as others I've taken. But no one's influenced me like he has.